morning show.
All right, y'all, Rick's Smiley Morning Show. Hey, it's about the time for Wellness Wednesday with the one and only Dr. M.J. Collier. We so happy to have you this morning. How you feeling, man?
Hey, Ricky, good morning, sir. I am doing wonderful, thank you. And good morning, Rock T, Special K, Gary with the T, Maria Moore, and the Brat, the entire morning show crew. So, Ricky, there are great things that are going on and breakthroughs over the past few years in the treatment of diabetes. SGLT2 inhibitor oral medications like Farxiga and Jardiance have changed the way we look at diabetes. Injectable GLP-1 medications like Ozempic and Mounjaro not only are controlling your diabetes, but also making you lose weight. But, Ricky, diabetes is a progressive disease disproportionately affecting people of color, 300% higher rates in African Americans with higher amputation rates. So a lot of diabetics ultimately will require treatment with injectable insulins. The problem is that at this later stage of diabetes, when the pancreas is no longer producing any insulin, it's when it's most important to keep the blood sugar controlled, because this is when you'll get the sequela of diabetes. The most common insulin regimen, Ricky, is what's called basal bolus therapy. So you take a long-acting insulin called insulin glargine, name brand like Lantus. You take that in the evening, and then you take a dose of insulin with each meal, sometimes before and after meals. So this may require 4 to 7 injections per day. And most people have big problems with doing this. Sometimes it's just a matter of finding a private location to draw up and inject the insulin. They usually try to do it in the bathroom at the workplace, or, they may be out and they got to pull over to the bathroom at the service station or something like that. Right. And what happens, it becomes so inconvenient, they just don't take the dose. And when they miss the dose, the blood sugar is all over the place, and then that's when they get the sequela of uncontrolled diabetes, blindness, amputations, heart attacks, and strokes. Well, Ricky, there's been a new breakthrough in the administration of insulin. An insulin delivery patch. It's about the size of a large Band-Aid, and you can apply it once daily. One name brand is called the Vigo patch, but you can just Google insulin patches if you are on insulin. But these patches are waterproof, and they can replace basal and mealtime insulin. It delivers insulin just like the pancreas does, providing insulin throughout the day. It delivers a continuous baseline dose called a basal dosing, and then this particular mechanism can give you pulse dosing in mealtime by either a remote control or you press a button, and it can give you up to 2 units per pulse. So if you're taking, say, 10 units with your meals, then you hit it 5 times, and then you're covered. So you don't have to worry about injecting and drawing up insulin. So that's 24-hour coverage with this patch. And in combination with continuous glucose monitoring, new devices like the Freestyle Libre or the Dexcom G7, this is like having an artificial pancreas. It's like really not having diabetes and not being in stage with your pancreas burned out. These computerized devices can be programmed to automatically deliver insulin on a regular schedule or provide insulin boluses on demand if your sugar goes up because of something that you've eaten. So this system helps ensure that the blood sugar levels stay within targeted ranges. So a much more modern alternative to insulin injections, and this will result in better control and more convenient treatment options. You got to ask your doctor about these so they don't have you drawing up insulin with a needle out of a bottle and trying to find a bathroom at the local service station to inject yourself. All right,
Rick. Dr. Collier? Yeah, my daughter wears one of those.
All right, very good, and that the control is incredible. And this is different from the older insulin pumps that require a little tube to be inserted in your abdomen, and that though you can fill in with more than 1 day's worth. But these patches, again, are very convenient, and almost anybody can use them if they're on insulin.
All right, let's go to the phone. Y'all, Dr. Collier, good morning.
Yes, I'm a black African-American female over the age of 40 and always get less than 6 hours of sleep. What would be a good multivitamin to help me stay energized and woke?
Okay, one thing, your immune system is compromised by that, so you need to take a couple of things. You need to take the vitamin D at 5,000 international units per day, omega-3 fish oil at 3,000 to 4,000 international units per day, and then a complete multiple vitamin with iron and minerals. So name brand doesn't matter. There's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. There's no better way to make them. So if you're paying more than 10 or 15 bucks for a bottle of 100 vitamins, you're paying for a pretty bottle or a celebrity endorsement. So just any name brand that meets that criteria that says a complete, not just multiple, because multiple just means more than one, but a complete multiple vitamin with iron and minerals. The ones I recommend by name, one a day for for women, Centrum, Z-Back.
All right, y'all, with Dr. Collier, good morning.
When I sit down for long periods of time, my right leg goes numb, like from my hip all the way down to my foot, so like there's something pinching. And I'm just wondering, what is that? It's just been happening like in the last maybe month or two.
You're sitting on that sciatic nerve, and that is creating a problem that can radiate all types of symptoms all the way down to your feet. That's called peripheral neuropathy. It can be numbness. It can be tingling. It can feel like pins and needles. It can feel like the leg is on fire, and it can just feel weak. And you get up and you move around, and you remove that pressure. So this is the ergonomics of what you're sitting in. Either it can be the chair or seat in your car. It can be the chair that sits at your desk. Something needs to be changed. You need to get a cushion that can go there to help relieve the pressure on that sciatic nerve. And make sure there's nothing in your back pocket like your cell phone or your wallet or anything that would press directly on that sciatic nerve. And note that the biggest problem that a lot of truck drivers have, they wear that wallet in their back pocket and they sit on it all day, and then they start having problems with the sciatic nerve on that side affecting that leg. So I tell them to take that wallet out of their front pocket, put it in their front pocket, and then they're fine.
Right, I know that's right. You're on with Dr. Collier. Good morning.
I want to ask him about my diabetes. My urine is really clear, and I'm urinating a lot, and lightheaded, head hurting, and the insulin is not bringing my sugar, but running really high. The insulin's not bringing it down. So I want to find out if there's something that I can do to bring my insulin, bring my sugar down.
Absolutely. One, when you're urinating that frequently, that's because of the high blood sugar levels, that diuresis, and it's called glucosuria. The glucose has an osmotic effect, and it makes you urinate out. You can get dehydrated, which is what's making you feel lightheaded, and it alters as your blood sugar goes up and down. Your brain literally shrinks and swells. And every time it shrinks or swells, and your eyeballs as well, it can give you blurred vision, it can give you headaches, it just makes you feel badly. So it's going to require a partnership between you and your doctor to put you on a regimen that will better control your blood sugars. What I just got through talking about, the insulin patch might be perfect for you, but since you're on insulin, that will make sure that you're getting correct doses throughout the day versus trying to chase those blood sugars, which is what most insulin regimens do. Your blood sugar goes up, you take insulin, you bring it down, sometimes too low, then you have to eat something to bring it back up, and this is the cycle that you go through all day, every day. So it requires more attention than that to your diabetes.
All right, there it is. I appreciate it, Dr. Collier. Let everybody know how you can be reached.
Rickey, I can be reached on all social media at AskDrMJ, Ask Dr. MJ. Subscribe to my YouTube channel, Ask Dr. MJ, for videos on various healthcare topics, and go to my website, lipodrops.com, where you'll find information and our Halloween discount special today, that keeps you healthy and boosts your immune system and help you lose weight. Vitamin D, omega-3 fish oil, lipoimmune to get you through this COVID, flu, and respiratory syncytial virus RSV season. So, Rickey, Ask Dr. MJ on YouTube. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew.